Hello and welcome. Today we're shedding light on a complex and often sensitive topic: anorectal cancer. This video aims to provide a comprehensive overview of this disease, covering its causes, symptoms, diagnosis, treatment, and more. We hope to empower you with knowledge and understanding. The exact cause of anorectal cancer isn't fully understood, but several factors can significantly increase the risk. Human papillomavirus, or HPV, is a major culprit, particularly HPV-16. Chronic inflammation in the anal region, such as that seen in chronic anal fissures or fistulas, can also elevate risk. Certain lifestyle factors like smoking and having multiple sexual partners are also implicated. Furthermore, individuals with a weakened immune system, perhaps due to HIV or immunosuppressant medications, are at greater risk. Family history may also play a role, though the genetic links aren't fully clear. Anorectal cancer typically develops when healthy cells in the anus or rectum undergo genetic mutations. These mutations cause the cells to grow uncontrollably and form a tumor. The process often begins with precancerous changes, such as anal intraepithelial neoplasia, or AN, which can progress to invasive cancer over time if left untreated. As the tumor grows, it can invade surrounding tissues and organs, such as the sphincter muscles, lymph nodes, and even distant organs through metastasis. The spread often occurs via the lymphatic system to nearby lymph nodes, eventually spread through blood flow to liver, lungs, and bones. The growth and spread of anorectal cancer disrupts normal bowel function and can cause pain, bleeding, and other complications. Anorectal cancer is relatively rare compared to other types of cancer. While specific numbers vary by region, it's more common in women than in men, particularly those with a history of HPV infection. The incidence tends to increase with age, with most cases diagnosed in individuals over the age of 50. Certain populations, such as those with HIV or weakened immune systems, also have a higher incidence rate. It's also worth noting that screening programs like Pap smears, which detect abnormal cells in the cervix, do not routinely check for abnormal cells in the anus. This means anal cancer is often detected later at later stages than other cancers. The signs and symptoms of anorectal cancer can be subtle and easily mistaken for other, less serious conditions, such as hemorrhoids. Common symptoms include rectal bleeding, itching or pain in the anal region, a lump or mass near the anus, changes in bowel habits such as constipation or diarrhea, and a feeling of incomplete bowel movements. Some individuals may also experience a narrowing of the stool or pain during bowel movements. It's crucial to consult a doctor if you experience any of these symptoms, especially if they persist or worsen. Early detection is key to successful treatment. Diagnosing anorectal cancer typically involves a combination of physical exams and diagnostic tests. A digital rectal exam allows the doctor to feel for any abnormal lumps or masses. An anoscopy or proctoscopy uses a thin, lighted tube to visualize the anus and rectum. A biopsy, where a small tissue sample is taken for microscopic examination, is essential to confirm the presence of cancer. Imaging tests, such as MRI, CT scans, and PET scans, help determine the size and extent of the tumor and whether it has spread to other parts of the body. And rectal ultrasound provides a detailed image of the tumor and surrounding tissues. The most common type of anorectal cancer is squamous cell carcinoma, which originates from the squamous cells that line the anus. Adenocarcinomas, which develop from glandular cells in the rectum, are less common but can occur in the anorectal region. Other, rarer types include melanomas, sarcomas, and neuroendocrine tumors. The specific type of cancer influences treatment options and prognosis. Treatment for anorectal cancer typically involves a multidisciplinary approach, combining surgery, radiation therapy, and chemotherapy. Surgery may involve local excision for small tumors or more extensive resection for larger tumors. Radiation therapy uses high-energy beams to kill cancer cells. Chemotherapy uses drugs to destroy cancer cells throughout the body. The specific treatment plan depends on the stage of the cancer, its location, and the patient's overall health. Targeted therapies and immunotherapies are also being explored as potential treatment options, particularly for advanced disease. Close follow-up is crucial after treatment to monitor for recurrence. While it's impossible to guarantee prevention, several steps can reduce your risk of anorectal cancer. Vaccination against HPV is highly effective in preventing HPV-related cancers, including anal cancer. Practicing safe sex, including using condoms, can also reduce the risk of HPV infection. Quitting smoking is essential for overall health and can also lower the risk of many cancers, including anorectal cancer. Regular checkups and screenings, particularly for individuals at higher risk, can help detect precancerous changes early, when they are easier to treat. The prognosis for anorectal cancer depends on several factors, including the stage of the cancer at diagnosis, the type of cancer, and the patient's overall health. Early detection and treatment significantly improve the chances of survival, Recent research is focused on developing new and more effective treatments, including targeted therapies and immunotherapies. Researchers are also exploring ways to improve early detection through improved screening methods. Ongoing clinical trials are crucial for advancing our understanding of anorectal cancer and improving patient outcomes.